Have you ever heard about a nurse who amputated a patient's foot without the patient's permission? Yes, there is. And what's worse is she was planning to put this on display on a taxidermy shop. Yep, that's what she was planning to do. And what makes it worse, she was planning to put a sign on it on that foot. A warning sign saying, "Wear your boots, kids." Generally, I know nurses are kind of weird with a lot of things, but this case, I think it's really top zero. Really, it's a different level. What happened with the old guy is patient fell at home, and unfortunately, she wasn't able to get up, and there was no like heating system, or like I think it was broken, so it ended up having some frostbite on his leg. Apparently, the leg was like too severe, like frostbite, so they couldn't really save it. And what's worse is the patient has more comorbidities, meaning there's really no chance of him surviving. So they decided to place him on a hospice care. So that's why he ended up with this nursing home. For those who doesn't know what hospice cares mean, it means the patient's about to die, and what they plan to do is just to make the patient comfortable until he passes over to the next life. The doctor didn't decide anymore to amputate his leg because they knew that the man's life was like close to death. So we were thinking he will die within like a few days or a week from that time. So they didn't really need or think that necessarily for the patient to undergo another surgery anymore. Unfortunately, the patient like lasted several weeks. So some of the nurse like felt pity on this patient. The nurse involved here was thinking about the patient's comfort. That's why she was thinking about amputation. So she was asking her supervisor or the doctors asking if they could amputate it because it will lessen the suffering for that patient. That's what they were saying that she was thinking. But I guess some of them were thinking like this is just an opportunity for her to get that particular foot and have it displayed at home or at the shop. So with this, she asked the supervisor's permission if she could like amputate the patient's leg. Of course, the supervisor said no. Definitely not, because this is not known. Nurses are not allowed to amputate this without the permission from the patient or nonetheless a order from the doctor. So definitely no. She was asked to stabilize the foot instead. So that was the order from the supervisor. But again, the patient still held on and he was sent dead until like few days still. So what Miss Brown said, like I think he's still suffering. So he gathered 3 of the other nurses to help him cut the patient's leg or amputate the patient's leg. I think rather they were nursing aides rather than registered nurses. So they gathered it up and they did amputate the patient's leg. The nurse used a gauze scissor in order to cut the patient's legs. They said only like the tendons were like attached to the patient's leg, so she just used that scissor. She was claiming the patient wasn't able to feel anything, but one of the nurses said it wasn't like a good way of amputation. Nope. Of course, we're not trained to do that. So they said it looked painful, and one of them said even the patient was complaining that the patient was hurting while doing the amputation procedure. After the foot was amputated, she then said they decided to preserve the foot and to bronze it. Yep, she did say that after. Unfortunately, Miss Brown didn't have an order from the doctor, did not have a permission from the nursing supervisor, or did not have a consent from the patient to amputate the patient's leg. So with this, I think the case ruled out. She will be facing 92 years imprisonment for intentionally causing great bodily harm to an elderly person and literally just mayhem for allegedly amputating a patient's leg using a gauze scissor. Being a registered nurse, we are bound to like rules and regulations in advocating for the patient, particularly if they are not able to talk or think for themselves. So we should abide for providing care for them, not thinking about our own interests, particularly doing like taxidermy and displaying on a shop with a warning label saying that's why you have to wear boots. So definitely that's out of the place. That's something really wrong with that particular nurse for doing this. If you were the nurse in this situation and you were seeing the patient like in pain, do you think you would ever consider amputating the patient's leg? If you do or not, please comment down below whatever your reaction is. Okay? So if you like this video, please click the like button, subscribe, and share it to your friends. I'm Nurse Juan de la Cruz, your OFW nurse. Thank you for watching, and bless. Bye-bye.